EMS.
Come in.
Hey, what's going on today?
I don't know. He just passed out.
Okay. What was he doing when he passed out? Was he just sitting there, or
I don't
you know? Did he fall, hit his head, or anything like that?
know.
No. Okay. All right. As I came in, I looked around, made sure there was no apparent dangers. Saw an elderly gentleman and his son sitting on the couch. Nobody else in the house. So, patient appears to be unresponsive. Relatively no information given by the child because he doesn't really know anything. So I'm gonna go ahead and do a quick assessment of the patient. I can see rise and fall of his chest. So I know that he's breathing, which establishes the airway and breathing. Appears to be breathing at adequate depth. Check his pulse real quick. He does have a radial pulse. So ABCs are established. I'm gonna go ahead and get some baseline vitals and see if I can determine what's going on with him. And so first off, I'd go ahead and hook up the monitor, blood pressure cuff, O2 pulse ox, and go ahead and hook up the leads. It's showing normal sinus rhythm. We'll go ahead and check his blood sugar. Does he take any kind of medications that you know of? You don't know.
I don't know.
You don't see him take any medicines or anything. Okay. I noticed there's a bin over here full of medicine, so I'm gonna kind of look through it and see if there's anything in there. I noticed some insulin needles. Do you know if your dad's a diabetic or not? Does he take shots or anything like that?
I'm pretty sure he does.
Okay. All right. I also see some beer cans sitting around here, so that's a little clue, just stuff that you see sitting around. Because I hope this little man's not drinking them. But all right, so I'm gonna go ahead and check his blood sugar. So I lost his finger off of it. Sir, can you hear me? Can you hear me? You're supposed to moan. Okay. He didn't respond when I called his name, and he barely moaned whenever I did the sternal rub. So we'll go ahead and say that he's barely responsive to pain. We'll go ahead and check his blood sugar. Blood sugar showing low. So at this time, I've identified that he is severely hypoglycemic. So we're gonna go ahead and start an IV. So get an IV started, and go ahead and give him 100 milligrams of thiamine, and then go ahead and give him 1 amp of D50. So the amp of D50 is pushed. Hey, buddy. Good morning.
Good morning.
You awake?
Mm-hmm.
All right. And give a good flush and bolus after the D50. Do you know where you are?
Home.
You're at home. Okay. Do you know your name?
Mm-hmm.
What's your name?
Greg.
You know what day it is?
Wednesday.
Okay. You know who the president is?
Trump.
All right. Giving the patient D50. So you just come back around, just alert and oriented to the person, place, and thing. So since we've identified the life threat cause, we're gonna go ahead and see if he wants to go to the hospital. Blood sugar bottomed out. So you need to go to the hospital, get checked out, make sure you got.
No.
Yes, you need to go. Your blood sugar was awful low. Have you had anything today?
No.
No? Okay. Did you take your medicine today?
Yes.
You did take your medicine. You know when you take the medicine, you're supposed to eat. If you don't eat, it bottoms your blood sugar out and you get to see me. So, at this point, he's kind of trying to be, he's kind of trying to be, reluctant to go to the hospital and get checked out. But, it's where we can continue to talk to him and try to get him to go.
You go.
Yeah, you need to go to the hospital. All right. So we need to call somebody to come take care of the little man. But so that's one thing that we established. That if we're taking him to the hospital, we gotta find somebody to take care of his son, because he's obviously not old enough to stay home by himself. He's like 6. But anyways, at this time, noting the size of the patient, I'm gonna go ahead and call for additional resources. We've made our transport decision. We are going to transport. It's not really as urgent at this time that we load and go, so I'm going to go ahead and call dispatch and get a fire fire brigade in route so they can help us with lift assist. And so let's see. 5 minutes already. So while we're waiting on that, I'm going to go ahead and recess his blood sugar and stuff again. Blood sugar is holding good. So what all medications are you on? And he rattles off a whole list. You know, I'm writing it down. You got your vitals. Okay. Alright, the reason why I get the thiamine first, I noticed the beer can sitting here, 2 of them open, 2 of them unopened. So it's apparent that he has a history of drinking alcohol, so we give him thiamine first. I noted that when I came in. And so we're gonna go ahead and get him loaded. Fire department's here. We get him loaded up on the stretcher in the ambulance. Okay, lay down. Now we're in the ambulance. Okay, we got him out of the house. We're in the ambulance. I wish we had rolling chairs in the ambulance. Alright, while we're here, I'm gonna go ahead and do a head to toe assessment. I'm gonna check his head, check his eyes. Pupils are equal reactive light. I'm gonna check his nose, ears, mouth, throat. There's not really no significant signs for any infection or anything like that. And let's see. I'm gonna check his arms, make sure he's got good pulses, everything like that. Check his chest. I'm gonna listen to his heart. I'm gonna go ahead and listen to his chest. Listen to the right side and then listen to the left side. Lungs sound clear and equal bilaterally. I'm gonna check his abdomen. I'm gonna listen to his abdomen, hear obvious bowel sounds. I'm gonna feel, starting with there's no complaint of any abdominal pain. I'll start with the right lower quadrant. Does this hurt? Okay. Does this hurt? Does this hurt? Does this hurt? Okay. Alright. Come on down. Just give him a look over, make sure ain't nothing broke. Which this is medical, so no obvious injuries. So I'm gonna go ahead and start my secondary assessment. And I'm just gonna go back over and reassess his vitals again and check him on the heart monitor. Go ahead and hook up or go ahead and run another 12 lead. Compare it to the original 12 lead and see what it's showing. Check his blood pressure. Alright. And check his blood sugar again. His blood sugar's holding fine. So it's basically just monitor him he's considered a stable patient now, so we can monitor him every 15 minutes on the way to the hospital. You still awake?
Yep.
Okay. Still feeling alright?
Yep.
Okay. You gotta eat when you take your medicine.
Eat something.
Yeah, you need to eat when you take your medicine. But alright. Alright, I'm gonna go ahead and call my report into the hospital. Alright, this is Medic 1 calling whatever hospital. I've got an en route with a, what are you?
51.
51. He's older than that. Anyways, en route with a 51-year-old male. Found responsive only to pain. Family called 911. Upon assessment, we found low blood sugar. And found his blood glucose level was showing low on the monitor, so we went ahead and gave him an IV, gave him an Amped 50, 100 milligrams of thiamine, then an Amped 50. Obtained patient medical history. He does have diabetes, insulin dependent. Patient states that he took his medicine today. Did not eat anything, and he said he's feeling better. His blood sugar is holding stable, about 90. So we'll be there in about 10 minutes or so. Medic 1 out.